Hello, this is Rico Caviglia. Welcome to the Fearless Aging Podcast, where in every episode, my guests and I, we strive to offer you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being. So we're here to inspire you and empower you to become your best self so you can go out and make a bigger positive difference in the world. And we definitely need you to do that. So before I introduce our episode today and our expert guest, I have a question for you. If you've been wondering how well you are aging, well, I've got the solution for you. If you go to my main website, agelesslivinglifestyle.com, you can take our aging assessment. And if you don't like the results, I offer you a free consultation and we can discuss what health and fitness and premature aging challenges you may be having. And I'll do my best to get you going on the right track. So go to agelesslivinglifestyle.com and check out our aging assessment. All right, so the title of today's episode is Why Do People Choose Surgery? And I'm going to add in their prescription drugs over regenerative medicine. And so this is such an important topic. So I'm really excited to have our guest on. So our expert guest is Carol Joy Bender. She's a nurse practitioner. She's founder of Joy Wellness Partners, which is a wellness hub in Southern California where individuals aren't just treated, but truly listened to, understood, and cared for. She's a distinguished nurse practitioner and alumna of the prestigious Wharton School of Business and the University of Pennsylvania School of Nursing. And she always dreamed of a place where the innate healing power of the body was not just acknowledged, but celebrated. I love that. That's exactly what we need. So, Carol Joy Bender, thanks so much for joining us.
It's such an honor. Thank you so much. It's very sweet to be on this show. And thank you for the mission that you carry out every day and what you do too.
Well, thank you so much for that. So, well, let's just start again. What got you started wanting to be a nurse practitioner, and how did you get the vision that this was a kind of a wellness hub that you wanted to create?
Sure. Well, my grandmother was a nurse. So when I started to pursue career options and continue to progress as a nurse, I realized that being a nurse practitioner would give me more leadership opportunities to really change people's future and understand the full concept of a person's medicine and medical journey. And I started in the emergency room as that was my dream job for a nurse practitioner role. When I quickly found that we weren't really solving any problems in most cases, there were a lot of people coming for common primary care concerns or orthopedic concerns like a knee injury. And we didn't really have the solution for them. If they were in severe pain, we would give them pain medications and they would come back a couple days later wanting more pain medications. And it was a really interesting eye-opener for me, my first couple jobs in the emergency room in California. So I started another clinic job where it was integrative medicine. And I saw through a few injection-based treatments, stem cell therapies, using the person's own stem cells to stimulate the cartilage to regrow in their knee. And the patient was walking later without needing the knee replacement. And it was inspirational. And we were making a difference in their life for the better. So I started to understand that that wasn't available in Southern California in many places. And I thought, well, what an opportunity to expand what's working and help people get more awareness about what they could tap into if they really wanted to.
Yeah, so good. Yeah, well, thank you for that. I always want to let our audience know, we've got it backward in this society. Mainstream medicine, it just kind of came in, allopathic medicine, and just tried to make everything else something that was quackery or maybe an alternative, right? But we really got it backwards. All the things you're talking about, functional medicine and natural healings, that should be our mainstream medicine. And then sometimes, drugs and surgery and those things, that's an alternative. Sometimes you need those. And as you know, if you have an acute situation, allopathic medicine is great. They can put you back together and save your life. But for most chronic illnesses that most people go see doctors, their treatments are not only pretty much not very effective, but they can be downright dangerous as well. So I think that's an important point to know. So what you're going to be talking about, what you offer, that really should be mainstream medicine. It's not an alternative.
Well, thank you.
Yeah, absolutely. Okay, so Well, tell us about some of the things that you offer at the clinic and some of the things that you've been able to see have really made it really helped a lot of people. And again, just kind of go over the why it's so important to really address the root cause and have a holistic approach to healing.
Yeah, well, you said it yourself that we kind of learned medicine a little bit backwards here in America. And so once I started to understand that there were underlying causes behind why people were feeling the way they were feeling, and that we could always peel off another layer and try to really understand the root cause, I started to understand what a better solution would be. So with our regenerative medicine injection-based procedures, for example, we call it applied anatomy. So when we look at a person's injury, say their knee, they have an ultrasound diagnostic exam, and we can look with tenths of a millimeter accuracy at all of the structures in their knee. And the patient moves their knee around and shows us that when I move it this way, when I bend it this way, when I stand on it this way, that's where it really hurts. And then immediately we can say, oh, there's the tear, there's the meniscus tear that's causing you your pain. Let's
Mhm.
put some growth factors in that area to stimulate it to heal again. And it makes a lot of sense when the patient sees it right in front of their eyes. Like it made sense to me. And I felt like seeing is believing. So it's like going to the root cause and really repairing it. That's just one example where we do it anatomically on a regular basis. It can go with medications as well, and trying to find out why somebody is having, fatigue and why they're having depression. We don't just prescribe a medication to give them an antidepressant medication. We try to find out why are they depressed, and we test labs and we dig deeper and we spend time talking with the patient, and we most importantly ask them, what's your story, and tell us how you got to where you are. And a lot of those answers, just taking the time, in one of our core values is to really listen to the patient and their story, and that shapes our treatment plan in a way that's very personalized, very customized, and very low chance of harm.
Yeah, it's so true. It's been proven in even scientific studies that just going to see someone, a healthcare practitioner, and if they listen to you and you feel that like they care about you and they're there to help you, that starts the healing process right there, doesn't it? That's a big part of
It's
the
so
healing
true.
process. Yeah. And then
I love
also,
that.
yeah. And then also, it's like I say, people need to totally understand that only the body can heal itself. And so
Hmm.
whatever's going on in your body, as you know, even the word disease is dis-ease. It just means the body's not at ease. And so you just need to get the body back in balance, and then the body can heal itself. So all the different techniques that are available out there have been around for hundreds and hundreds of years. So that's an important distinction that they need to know. Well, before we get into some more of the different methodologies that you guys use and some things that you really focus on that you really had good success with treating people, I just want to let our audience know that uh, at the end of our conversation here, we'll let them know. You can tell them, how they can contact you. I know you have some really good specials going on. Uh, and let me ask you, do you also work online? Can you help with people online as well?
Sure. So there's a slight limitation with the licensure that we have. So we're licensed to practice wellness care and consult with patients in the states of California and Utah currently. And if people
Uh,
are in those locations, they can go to our sites in Provo, Utah, and in San Diego, California. And anyone in the states, in either of those states, can contact us for telemedicine, and we do lab reviews, lab ordering, and supplement recommendations through that online platform.
okay. Okay, well, tell us a little bit about what are some of the issues that people normally come to see you and what you've had some really good success with.
Sure. So with hormone optimization, that's one of our fun opportunities to help almost any individual, especially those age 30 and over. A lot of times people come facing weight gain, fatigue, like they're sitting on the couch all the time on the weekend and they just don't know why they're so unmotivated. And so when we work with them, we help to optimize their hormones, and a lot of times it's a natural way, and if they need replacement, it's bioidentical as much as possible, and helping them to get off prescription medications. There was a story that really convinced me about the beauty of doing hormone replacement therapy, where there was twins, and the one lady went through a natural method and a integrative, hormone replacement plan, and her sister hadn't done that. And she was going to OBGYNs and was on 64 medications by the time she talked to her sister about it. And the sister said, try the natural method. And eventually they whittled down all those medications so that she could be naturally balanced without needing all the chemicals that she was on. Because, you know, a lot of them have side effects. And so you get a prescription for the side effect. And then you kind of don't really know what's working and what's not working. So what we do is we work with the most natural, the least prescription as possible, trying to get them to optimize their body's healing and get their body kind of cycling in the youthful way as much as possible. Help them with their sleep, help them with their stress, help them with their gut health, and getting layers peeled off. Sometimes people are ready to do all the diagnostics right away and they want to go and deep dive, or some patients just want to feel better immediately. So we have safe options for either person. And when they want to dive deeper, we're always ready for them. We have naturopathic doctors that can talk with them about what supplementation might be optimal or what natural prescriptions they could use. So that's the hormone plan, which really applies to almost any adult. When people get injured or when people deal with chronic injury that they ignored for years and their back pain just starts to act up, or their neck pain keeps them up at night, or their shoulder, they can't lay on one side, then they come into our clinic for the ultrasound diagnostic exam, and then they look into what treatment options exist. We have everything from PRP, A2M, ozone therapy, hydrodissection, and lots of different modalities to address the anatomy where it's damaged. So if there was a pinched nerve, then we use hydrodissection to open up the space around that pinched nerve. So it just means using fluid pressure with a needle around the nerve to separate the nerve. Like if you have a garden hose and it's kinked or you're stepping on it, the flow of the circulation can't go through it. So let's lift off all the pressure, all the spider web fascia that might have adhered to it, and let's give it freedom to move again, to get circulation, to get flow, to stop hurting. So those are some really cool strategies that ultrasound guided injections can provide at our clinic. And then of course, you know, PRP, that's your own body's growth factors that, you know, you've heard of, like when you have a scab from a cut on your arm, you have like that gooey, sticky feeling of yellow. Well, that's platelets. That's the PRP. Those platelets are used in the whole body to heal. And as we get older, the volume and the quantity of growth factors in those platelets goes down. So we help the body to heal itself by just harnessing a blood draw and then putting a large volume of platelets in the injury area. And then the body does the work. The body goes and sends its own stem cells to the area to recruit the right matrix to put that meniscus back together, for example.
Yeah, that's so good. All the treatments you're offering are just, I totally agree with all those things. And those are the procedures that people really need to know about. One question, well, I want to add on getting your hormonal system checked, why it's so important, particularly also for people who have been struggling with not being able to, you know, really reduce that excess body fat. That's one of the biggest reasons. No matter what you're doing, if you're dieting properly or exercising, all those things, but if your hormonal system's out of balance, you're not going to be able to reduce that excess body fat. So anybody who's really been having a problem with that, they definitely need to get their hormonal system checked out.
That's perfect. Yeah, I totally agree.
I know, unfortunately, most of these therapies that can really make a difference, they're not covered by insurance. Have you seen any progress in these areas? More and more of these things are, hopefully can be covered by insurance?
Yeah, that's a great question. And what we've seen right now is that there are more research studies being done on regenerative medicine and stem cells. And the state of Utah on May 1st, they authorized non-FDA approved stem cell and growth factor and umbilical cord Wharton's jelly type procedures are going to be authorized in the clinics in Utah. So the whole state can put a sign up in their clinic and say, we're going to be doing these stem cell procedures that are not FDA approved. So at least there are some states and there are some, you know, different universities that are doing research to try to bring it to the full level of FDA approval so that then insurances can cover it. But in the meantime, we're trying to keep our costs low and lower than the cost of a car repair. And we're trying to help people to do it in a way that would be a worthwhile investment in the meantime. But the flex spending accounts, health savings accounts, you know, payment plans are kind of the best ways to go about affording these treatments in the meantime.
Yeah. So what do you think that needs to be done to make the insurance companies understand that if they start covering a lot of these alternatives, they're actually going to save money because they're going to get people well and they're not going to be, have to keep on paying them when they go see their other doctors for all these other procedures.
I 100% agree, and I wish it were that simple. I feel like if there was a monetary case to be made, then it
Yeah.
would be case over, done, but I know there's a lot of players at stake, and there's a lot of people that don't want to
Well,
lose the
yeah.
opportunity to prescribe
Right.
their medications or get them dispensed. So I think that, it's a business game too.
Yeah, no question about it. Unfortunately, it's almost always about the money, isn't it? Yeah,
Mhm.
most everything is going on.
Exactly.
Politics
Yeah,
included for sure. Okay,
sure.
well, again, I really highly recommend what you're doing. I got to come see your clinic myself. I got to come and see you and check out all the things that you're doing there. And so I know you have
Love
some
it.
specials going on right now. So tell us about what really great specials you have for people who can come see you.
Yeah, wonderful. If anyone is interested in getting their knee or their shoulder or their back or any area of their body examined for pain, come to our San Diego location or our Utah location for a $99 ultrasound diagnostic exam to find out the root cause of your pain and to try to get a natural solution. We also offer $100 off our hormone testing for anybody that's listening to this podcast. Just say Rico 100 and you'll get $100 off your initial consultation with the lab work included to help dive deeper into that hormone imbalance. And again, if you're in Utah or California, you can do that remotely with our telehealth team.
Great. Thank you for that. Okay, so well, we'll put your contact information in the show description, but do you want to go ahead? How do people? What's the best way to people to find you?
Yeah, sure. So joywellnesspartners.com, JOY wellness, partners with an S.com is our website. And they can also text us or call us at 858-609-0866, and we'll get them in touch with the location that's best for them. You can also email us at info@joywellnesspartners.com.
Yeah, and I'll put all that in the show description. Do you have more than one location in San Diego?
Just one in San Diego and one
Okay,
in Provo, Utah.
okay, all right, very good. So, what would be the last thing that you'd like to tell our audience, maybe just to inspire them to take some action and get some new ideas of what's going on with them?
If any of this sounded familiar to you and you've been on the fence of whether you want to try, I would encourage you to give it a shot. No pun intended, but
Yeah.
there's really no harm.
So,
And we really love to help people feel comfortable here. All of our family members, this is the care we would recommend to them. We are as honest as we can possibly be about everything top to bottom. So just give us a call, ask some questions, and perhaps you know someone who could benefit from it. And they just need to hear a real voice talking about it. We're more than happy to be available to share our experiences and how it's changed our lives and the patients' lives around us.
yeah, that's so good. So I highly recommend you check out the Joy Wellness Partners clinic, either in San Diego or in Utah. And as I said before at the very start, just going to and to a place like your facility and to talk with someone like yourself, that's the best way to start the healing process right there, because then somebody who's really takes the time with you and care about your healing trip.
Oh, thank you. Thank you
Uh,
so much.
My pleasure. So I always like to end all of my podcasts with one of Einstein's favorite sayings, that knowledge without action is useless. So we always offer you some really good knowledge and information and some tips. So you got to step up and take action on it. So I highly recommend that you, if you're having any of these issues that you haven't been resolved, you definitely should check out Joy Wellness Partners. So if you enjoyed today's episode, tell your friends about the Fearless Aging podcast and give us a good review wherever you listen to your podcast. And once again, I want you to know that all the things we talked about, you just have to step up. You can do it, and you'll be glad that you did. So thanks, Joy. Thanks so much for being here, Carol. That was great.
Thank you so much, Rico. This was awesome. It's really fun to have passionate people to work with and share good knowledge and good action items.
Yeah, absolutely. Thank you.